The latest advances in public health and healthcare serving different populations. In recent years, there have been significant advances in the field of community health and healthcare services that are designed to meet the needs of diverse populations. These advances are enabling healthcare providers to provide more effective and efficient care, and to address health disparities among different groups. One of the most significant advances in community health and healthcare services is the use of telemedicine. Telemedicine allows healthcare providers to deliver medical care to patients remotely, which can be particularly useful for patients who live in rural or remote areas. This technology can also be used to provide mental health services, which can be especially helpful for individuals who may not have access to mental health providers in their local communities. Another important advance in community health and healthcare services is the use of electronic health records, EHRs. EHRs allow healthcare providers to access patient information more quickly and efficiently, which can improve the quality of care. EHRs can also improve communication between different healthcare providers, which can lead to better coordination of care for patients. In addition to these technological advances, there have also been important developments in community health and healthcare services that are designed to meet the needs of specific populations. For example, there have been efforts to improve healthcare access for low-income and uninsured individuals, such as the expansion of Medicaid in some states. There have also been efforts to address healthcare disparities among racial and ethnic minority groups, such as the development of culturally sensitive healthcare programs. There have also been important advances in community health and healthcare services that are designed to meet the needs of older adults. For example, there have been efforts to improve care coordination for individuals with multiple chronic conditions, as well as the development of age-friendly healthcare facilities that are designed to meet the needs of older adults. Finally, there have been important advances in community health and healthcare services that are designed to address the opioid epidemic. These efforts have included the development of programs to prevent opioid misuse and addiction, as well as the development of programs to provide treatment and support for individuals who are struggling with opioid addiction. One of these advances is the use of personalized medicine. Personalized medicine involves tailoring medical treatments to an individual's specific genetic makeup, lifestyle, and health history. This approach can lead to more effective treatments and better outcomes for patients. Another important advance in community health and healthcare services is the development of community health worker programs. Community health workers are individuals who are trained to provide basic healthcare services, health education, and support to individuals in their communities. These programs can be particularly effective in reaching underserved populations and improving health outcomes. There has also been progress in addressing social determinants of health, such as poverty, housing, and access to healthy food. Healthcare providers are recognizing the importance of addressing these factors in improving health outcomes, and are working with community organizations and government agencies to develop solutions. Technology is continuing to play a significant role in advancing community health and healthcare services. For example, wearable technology such as fitness trackers and smartwatches can help individuals monitor their health and make lifestyle changes to improve their overall health. Mobile health apps can also provide individuals with access to healthcare information and resources. Finally, there has been progress in healthcare policy that is designed to improve access to healthcare and reduce healthcare costs. For example, the Affordable Care Act has expanded access to health